Hi everyone, my name is Diana, the phlebotomist for LabCare Express, and today I want to talk to you about what the phlebotomists need to know, the common labs, tests, and their meaning. Sometimes we get lab order from the providers and we don't know exactly what is it for or what tubes to use and what's the meaning of doing it. So take some notes. This video is for new students and new phlebotomists that need to master this topic. And yep, it's just some common tests that I wanted to show you guys. If you have any comments, please comment below. If I forget something, please comment below. And we're gonna start now. So we're gonna start with the CBC. This is the complete blood count. This one is the most common test, especially for routine checkup. You're gonna see this test in every order if you're doing a routine checkup, because this one is to check if you have infections. It's checked for anemia. It checks for your red blood cells, your white blood cells, platelets, that is very important, and if you have any issues, hematologist issues. So this one is very important because it checks for these things that are needed. So if you get this lab test in your order, you should get a lavender tube. That's the tiny one, and that one you need to invert 8 to 10 times because that tube has an additive that is called EDTA that is an anticoagulant, so the blood doesn't clot. So you need to invert as soon as you draw the blood. You need to invert 8 to 10 times so you can mix the additive with the blood. So yeah, take a note on that. The next one will be the CMP. It's the Comprehensive Metabolic Panel. That one we're gonna use the SST tube, the gold one that's yellow, or the red one. Those tubes comes with a gel separator because it needs to be centrifuged and get the serum from it. It separates the blood from the serum, and you get the buffy coat in the middle. This one needs to be clot for 15 minutes depending on the instruction from the provider, and that one, it checks for your electrolytes, your glucose, your kidney function, your liver function. It's very important because it checks your overall health. So this is for the CMP. Another common test is the lipid panel that checks for your cholesterol. It checks the good one, the bad one, and triglycerides. So this one is also in the SST tube, the gold one or the red one, but that one require for you to be fasting 8 to 12 hours because you're doing a cholesterol check, and to get accurate results you need to be fasting. So before you do it, you need to ask your patient if they were fasting the day, at least 12 hours. But sometimes there's some doctors that they don't really require to be fasting, but it's important to ask the patient before you draw the blood. So those are the tubes and the blood tests that you probably will see in your everyday as a phlebotomist. I know there is 1,000 more tests. I just wanted to give some information in the most common ones. So if you enjoy my video, give me a like and comment below if you want more videos like this one. Thank you for watching.